There is no doubt that the mother's milk is the best form of food for the baby. Hence, we doctors always encourage mothers to exclusively breastfeed till the age of 6 completed months. However, there might be situations where breastfeeding is either not possible at all due to medical reasons or needs to be supplemented. In both these situations, formula feeding is a good alternative or supplement for breastfeeding. In my professional practice, I have observed that parents typically have a lot of apprehension regarding formula feeds. Therefore, in this video, I will answer some of the common concerns that most parents have and also advise on the best practices to follow while formula feeding your baby. One of the most common questions that parents often ask me is whether to supplement breast milk with formula milk or cow's milk. Now, the answer to this question is formula milk. Formula milk is specifically designed to replicate most of the characteristics of breast milk. Hence, it is the preferred alternative for breast milk. However, it's important for parents to strictly adhere to the usage instructions of formula milk, as incorrect usage can lead to problems such as constipation and dehydration. Cow's milk, on the other hand, is difficult to digest and can cause constipation and allergies. Additionally, it is deficient in certain important nutrients like iron and contains higher levels of sodium than breast milk. The high level of sodium can adversely affect a newborn's kidney. Therefore, cow's milk is not recommended for children less than 1 year of age. Now that we have determined that formula milk is a suitable replacement and supplement for breast milk, the next obvious question is how to feed the formula milk to the baby. As doctors, we discourage parents to use the bottle for formula feeding, although it seems to be the most convenient option. There are multiple reasons for discouraging the use of bottles. Firstly, bottle feeding has been associated with a high number of stomach and respiratory tract infections. Since the nipple of the bottle is porous, it quickly becomes a house for bacteria to strive, and simply washing it with hot water does not work. Unless the nipple is sterilized after every feed, it is not safe to use it for your baby. Secondly, bottle feeding may cause nipple confusion in the baby. Since milk is passively sucked from a bottle, unlike the active suckling of breast milk, this may cause the baby to refuse breastfeeds later. Thirdly, bottle-fed babies tend to gulp milk rapidly. This causes swallowing of air and may result in colic. Considering all these disadvantages associated with bottle feed, it is therefore recommended to either use a stainless steel or a metal palada or cup and spoon. It is common for babies to pick up infections unless the feeding equipment is properly sterilized. Sterilization helps to keep the harmful bacteria at bay. The simplest method to sterilize the feeding equipment is to leave all parts of equipment in boiling water for about 10 minutes. A word of caution: washing with hot water, however hot, will not sterilize the feeding equipment completely. Therefore, before each feed, please ensure that all feeding equipment are thoroughly sterilized. Alternatively, there are a lot of automated sterilizers available in the market which can also be used. However, remember to strictly follow the instructions specified on these sterilizers. Let me advise you on certain best practices and precautions that should be followed while formula feeding. Unless breastfeeding is not possible due to any reason, always breastfeed the baby first and then offer formula milk as a top-up. Ensure that you read and follow the manufacturer's instructions carefully. Water used to prepare your baby's feed needs to be boiled for at least 10 minutes and then cooled to the desired temperature suitable for feeding your baby. Add the desired water first and then add the powder. Always sterilize feeding equipment carefully as instructed. Formula feed should be used within half hour of preparation. The excess milk should be discarded immediately and never be reused or reheated. It is important to burp the baby after each feed. Hold your baby upright for about 10 minutes and gently tap the baby's back to release the trapped air. Remember, the release of air does not always produce a burp sound, yet it's advisable to follow this burping practice after each feed. Do not add any sweeteners such as sugar or jaggery to the baby's milk. These are some of the simple practices that all parents should follow while formula feeding. It is common for mothers to ask, how much milk should my baby drink? The right quantity of milk differs for each baby. Parents should keep a close watch on their baby's weight, gain, and general well-being. These two factors determine quantity of milk required by the baby. So during your regular visits to your pediatrician, if you observe that your baby is not gaining weight appropriately to his or her age, then please discuss with your doctor regarding the milk intake. However, to answer the question, it is advisable for an infant to consume about 150 to 180 ml per kilo per day. Now, let me quickly go over the main points discussed in this video again. Mother's milk is the best form of food for your baby. However, in circumstances where breastfeeding is not possible, formula fill can be given as a supplement or replacement for breast milk. Formula milk is designed to closely mimic breast milk and hence it is a good alternative for breast milk. Cow's milk is not advisable for children less than 1 year of age, as it is not only difficult to digest but can cause allergies. Avoid bottle feeding as it can lead to infections and also cause nipple confusion in babies. The best way to feed the baby is to either use a stainless steel or a metal palada or cup and spoon. Sterilize all the feeding equipment after each feed. Breastfeed the baby first and then give formula milk as a top-up. Formula feed should be prepared and used within half an hour of preparation. Never reuse or reheat the leftover formula milk as this can cause contamination and infection. And finally, it's important to burp the baby after each feed to release trapped air.